So, Dr. Marks, what are the primary differences between an emergency care and urgent care clinic?
Yeah, and I think it's incredibly impressive to hear how many emergencies Trupanion has been there for so many pet families, because it is a big part of being a pet parent. We can't ever plan with it. It always happens when your general veterinarian is closed, right? We hear that all the time, and as a pet parent myself, I've had that. But there is a little bit of a difference between emergency and urgent care, and so I want to make sure everyone is aware. Emergency veterinary care centers are really there for two types of emergencies. So the life-threatening situations that require immediate attention, and then the critical cases that require either specialty or what we call critical care specialists. So these are emergency veterinarians who have gone through a residency and are trained in critical care, where they need to be in an ICU setting overnight to several days. So that could be anything from sudden accidents and traumas, severe injuries, or very acute illnesses that your pet might unfortunately succumb to. Anything that we say sort of poses an imminent threat. That would be things like difficulty breathing, severe acute bleeding if they cut themselves or have some type of bleeding episode, seizures that are not resolving, ingestion of a toxic substance when your generalist is not open, any kind of severe pain, like unfortunately that a human might experience where it's not being managed in a home situation, or other kinds of distress. So in those critical moments where we need either a critical care specialist, or again, that overnight care that could take care of life-threatening emergencies, that's where the emergency clinics shine. That's what they're there for. In comparison, though, urgent veterinary care centers have sort of been modeled after what we sort of know as the minute clinics, okay, of the human world. And they're meant for more of the minor injuries, minor illnesses, things like diarrhea, maybe one episode of vomiting, but otherwise fine, some wounds or small lacerations from the dog park, allergic reactions, those kind of things. And it's for something that needs prompt attention, but probably isn't life-threatening. Now, there's sometimes a little bit of blurriness there, right, with pet parents. And we'll talk today a little bit more about some of the other options that you have to sort of sort out, do I need to bring my pet somewhere? And where is that somewhere? Can I bring to urgent care? Can I bring to an emergency setting? The one thing I want to say about urgent veterinary care, though, is that there are a lot of generalist practice today that also have an urgent care option. And these urgent cares typically have the classic urgent care hours that many of the human centers do. So sort of the late afternoon into the evening, but urgent veterinary care centers are not going to have overnight 24-hour care, and they aren't going to have the specialty component that many of the emergency and critical care centers will have. And I think as we talk through this today, I'd love for pet parents to have a better understanding that now that urgent care centers are becoming more prevalent, it is an option to sort of sort out and even start to learn how to self-triage some of these emergencies, so that perhaps sometimes an urgent care is much better for you from a priority and efficiency perspective, also from a cost perspective, than going to an emergency clinic and saving those life-threatening situations for that, which also helps that emergency clinic really triage and take the priority of those very severe cases that need prompt attention.